You're right. Currently, the way near infrared technology works is that you have the camera system that we were just talking about, but then you also have to have a fluorophore. So you need something that actually fluoresces. And what people use now is a dye called ICG that's injected into the patient's arm and into their bloodstream, and it goes all over their body. Um, and this is good for things like looking for where the blood flow is or seeing if there's perfusion to different tissues like the bowel, or if you're doing plastic surgery, you want to make sure you have a robust flap. Also, they use it for lymph nodes. So if someone has endometrial cancer, for example, or cervical cancer, you can inject the ICG and look for the sentinel lymph nodes. I mean, you're in the oncology space, so you know about this. But those are pretty limited circumstances. Right now, you use ICG for an angiography, so just looking for blood flow or looking for lymph nodes. And that's not what I do for the most part. Um, the way that I ended up wanting to incorporate near infrared is I saw all these other surgeons doing it for removing the gallbladder or for lymph nodes. And I'll tell you, surgery is not easy, right? Surgery is just not easy. And surgery is becoming more difficult as the population gets older. People have more surgeries per person. People are more obese than they used to be. So all these things add up for surgery becoming more difficult. And I wanted to find a way to make it easier. And I thought maybe it was just me that I needed it to be better because I just couldn't see well enough, no matter how good these surgical systems were. But then I started talking to other surgeons, and I'm not alone. Everybody wishes they could see better. And then that's when I started doing research during my fellowship and produced this polymer that can fluoresce under near infrared. Because it does me no good to inject a fluorophore into someone's vein. That's not going to help my surgeries. So I needed to harness that technology and put it to use in a way that's going to help me and other surgeons in general.